In this video, we are going to be talking about the anatomy and physiology of the lungs. These are two-shaped lungs lying on each side of the midline in the thoracic cavity. And if you can closely observe, you'll notice that the right lungs is larger and wider than the left lungs. This is because the heart occupies some part of the left lungs, making it to be smaller and narrower. And if you can also observe, there are fissures that are located on both sides of the lungs. The right lung has 3 lobes, while the left lung has 2 lobes. We have the superior lobe, we have the middle lobe, and we have the inferior lobe. Superior, middle, and inferior lobe. While the left lung just has 2 lobes, which is the superior and inferior lobe. Now, there are surfaces that are located on both sides of the lung, which include the apex, the costal surface, the medial surface, and the base. Just the same in the left lungs: the apex, the medial surface, the base, and the costal surface. The apex is the part pointing in the roof of the neck, while the costal surface is the outer part we already seen. Then the medial surface is the part that faces the other lung, while the base is the part that lies on the upper part of the diaphragm. Now there is what we call the ileum of the lungs. This is where structures do enter and leave the lung from the posterior surface. And the structures include the primary bronchus, which is also called the airway, which carry air from the trachea down to the lungs. We also have the pulmonary artery, which carry deoxygenated blood from the heart sent to the lungs for it to become oxygenated. We also have the 2 pulmonary veins, which carry oxygenated blood from the lungs back into the heart for it to be sent to different parts of the body. Now we also have the lymph and nerve fibers, of course. Now there is what we call the airway pathway. This is how air passes down from the nose into the lungs. Air will pass through the nose, the pharynx, the larynx, the trachea, the bronchi, the bronchus, and finally to the alveoli, where gas exchange occurs. The alveoli are tiny air sacs that allow gas exchange to occur due to the high surface area. Now the pulmonary artery that carries the oxygenated blood from the heart will be sent to the alveoli. It further divides into tiny vessels called capillaries that allow diffusion to occur. Now these capillaries will wrap around the alveoli for diffusion to occur. The alveoli gives the capillaries oxygen, while the capillaries gives it carbon dioxide, because the pulmonary artery carries blood that is rich in carbon dioxide. Now the capillary will modify or change into what we call pulmonary vein that will return the blood back into the heart. Remember, the blood carried by the pulmonary vein is highly oxygenated because it just got the blood from the alveoli of the lungs. There is what we call the mechanism of breathing, which is divided into 2, which is inhalation or inspiration, which is the art of taking air into the lungs, and exhalation or expiration, which is the art of moving air out of the lungs. Now what happens during inhalation, that is when you breathe in oxygen? There is what we call the diaphragm, the intercostal muscle. When you breathe in oxygen, the diaphragm will contract. The contraction of the diaphragm makes it to move downward and flatten. Again, the intercostal muscle, that is the muscle between the ribs, will contract, making the ribs to move upward, outward. Now, air pushes into the lungs. Now, during exhalation, that is when you breathe out oxygen, the diaphragm will relax. The relaxation of the diaphragm makes the diaphragm to be moving upward, that is to its normal position. Now, the intercostal muscle during exhalation, that is the muscle between the ribs, will relax. The relaxation of the intercostal muscle makes the rib to move downward, inward. Now, air pushes out of the lungs. Breathing works by alternating expansion and contraction of the thoracic cavity, changing the pressure in the lungs, making air to move in and out. Now, if you have any question about the respiratory system, you can drop it at the comment section. I promise to reply to them. Thank you.